Alright, so the disorder I had was Fdia, factitious disorder imposed on another. This is also known as Munchausen by proxy. The history of it: Munchausen syndrome was first described in 1951 in a group of patients who invented illness stories and made doctors perform unnecessary surgical procedures. Munchausen syndrome by proxy is the same, except the patient isn't lying about their own medical condition, they're lying about the medical conditions of somebody under their care. It was specified as a form of child abuse, and it was described in 1977. It was named after an 18th century German dignitary named Baron von Munchausen, who was known for telling outlandish and over-exaggerated stories. Moving on to behaviors, Fdia is a psychological disorder characterized by a pattern of behavior in which someone, usually a mother, induces physical illness or injuries upon another person, usually her child. The mother is often faking the child's illness to get attention for herself, and this disorder is often associated with pathological lying. Some of the behaviors include giving the victim certain medicines or substances to create symptoms, not giving the victim enough to eat so it looks like he or she can't gain weight, adding blood to the victim's urine or stool, making up lab results, appointments, hospital stays, previous diagnoses, and lying to doctors. The treatment for this: typically, caregivers who have this condition need long-term counseling. Medicines are used only when the caregiver has another health problem, so medication isn't really used to treat this problem. After treatment, the caregiver is watched closely to make sure that their behavior doesn't relapse, and for the victim, they are moved into safe custody and monitored for any symptoms. Oftentimes, the victim also requires counseling because this is a form of abuse. Moving on to the historical example, Mary Beth Tinning. Mary Beth Tinning is an extreme case of Fdia. In order to garner sympathy for herself, she murdered all but one of her 9 children. The one that she didn't murder only lived to 8 days and died of natural causes. Tinning repeatedly brought her newborns to the emergency room and pestered doctors. After the infants were examined and there were no symptoms found, they were sent home. But then she would return to the emergency room with each deceased child, saying that they had mysteriously died at home from seizures, going blue, and cardiac arrest. She got a lot of attention for the tragic deaths of her children, and a rumor went around saying that she carried a death gene. When she asked why she brought more babies into the world if they're destined to die so shortly after, she responded that that's what women are supposed to do. So she murdered 8 out of her 9 children and framed it as a burden that she had to bear, and by continuing this cycle after 9 children, she brought more and more sympathy for herself, and that is what the person with Fdia wants. They want attention for themselves by showing that they are either have something unfair against them, like Mary Beth Tinning with this death gene, or that they are a good caregiver for the person that they are actually inflicting the symptoms on.